Now we will discuss about last topic in the orbit, ophthalmic division of trigeminal nerve. To see the exact location and course of that nerve, I am taking the transverse section of skull and I am seeing from above. That means I am going to draw here interior of skull. That means cranial cavity I am going to draw here. See here, I am taking the transverse section and I am seeing from above so that I can see the cranial cavity, right? So here I am drawing cranial cavity. So this is cranial cavity and it is divided into anterior cranial fossa, middle cranial fossa and posterior cranial fossa, right? So here this is anterior clinoid process. Right? So this is anterior cranial fossa. In the anterior cranial fossa, in the middle part, you can see crista galli. This is crista galli. On either side of crista galli, you can see cribriform plate of ethmoid. This is plate of bone. It belongs to ethmoid bone. It contains so many pores. That's what this part of the bone, what we are calling cribriform plate of ethmoid. So here you can see so many holes. At the anterior part, on either side of crista galli, you can see one slit. This slit what we are calling nasal slit. Then in the posterior part, here posterior clinoid process you can see, and this is dorsum sella. So this is middle cranial fossa and this is posterior cranial fossa. Here you can find foramen magnum. Is it? This part is petrous part of temporal bone. Of course here foramen lacerum will be present, right? And this is petrous part of temporal bone. Clear? And here you can see pituitary fossa. Right? Actually this is body of sphenoid. So here pituitary fossa will be present. Clear? Medial to the anterior clinoid process, you can see one canal here. What is this canal? This canal is optic canal. Is it? So this is optic canal. Right? Here you can see one fissure here. What is this fissure? Superior orbital fissure. This is superior orbital fissure. Of course this side also superior orbital fissure. This is body of sphenoid. On either side of body of sphenoid, you can find one sinus, dural venous sinus. What is that? That sinus is cavernous sinus, right? So this is cavernous sinus. Of course this side also cavernous sinus. At the apex of petrous part of temporal bone, you can see one fossa. That fossa is for the accommodation of trigeminal ganglion. That fossa what we are calling Meckel's cave. Is it? Or trigeminal cave. Within the trigeminal cave, we can find ganglion. What is that ganglion? Trigeminal ganglion. So this is trigeminal ganglion. Right? This trigeminal ganglion will give three branches. What are those? One is ophthalmic division of trigeminal nerve. This is ophthalmic division of trigeminal nerve. Then maxillary division of trigeminal nerve, mandibular division of trigeminal nerve. So this nerve is ophthalmic division of trigeminal nerve. So this is ophthalmic division of trigeminal nerve. I will draw with different colors to differentiate different nerves. This ganglion posteriorly it is connected to the pons. Is it or not? So here you can find cut section of pons. This is pons. So it is connected to the pons. This is trigeminal nerve. This trigeminal nerve attaches to the pons posteriorly. This is ophthalmic division of trigeminal nerve. And any other nerve is there? I am drawing with different color to differentiate. I am drawing with red color. Which one is this? This is maxillary division of trigeminal nerve. What is this? Maxillary division of trigeminal nerve. And one more division is there, no? What is that? That division is mandibular division of trigeminal nerve. What is it? Mandibular division of trigeminal nerve. This mandibular division of trigeminal nerve, after taking origin from the ganglion, it enters into infratemporal fossa through the foramen ovale. So here foramen ovale is there. Through this foramen, it is entering into the infratemporal fossa. We are least concerning about this nerve at this session. We will discuss this nerve in the infratemporal fossa. We are concerning more about this nerve. What is this nerve? Ophthalmic division of trigeminal nerve, and little about maxillary division of trigeminal nerve at this session. So this is ophthalmic division of trigeminal nerve. It is passing through which sinus? Cavernous sinus. So it is passing through the cavernous sinus. Not only these two nerves, there will be passages of third cranial nerve, fourth cranial nerve, abducens nerve, internal carotid artery. If you take the section along the body of sphenoid, you can see the structure like this. This is pituitary fossa. This is body of sphenoid. On either side of body of sphenoid, you can see sinus. What is that sinus? This is cavernous sinus. This side also, this is cavernous sinus. Of course, here body contains sphenoidal air sinuses. Right? Within the sella turcica or pituitary fossa, we can found pituitary gland. This is lateral wall of cavernous sinus. This is lateral wall of cavernous sinus. Some nerves will be passing from above downwards. This nerve is third cranial nerve. This is fourth cranial nerve, and this is V1. V1 means what? This one. Ophthalmic division of trigeminal nerve. Then V2. V2 means maxillary division of trigeminal nerve. And one more nerve will be coming from the trigeminal ganglion, but it is not passing through the cavernous sinus. This one will be present here. Then through the center of cavernous sinus, two more structures are passing. What are those? This is internal carotid artery. Then abducens nerve. That is sixth cranial nerve. So this is sixth. So these are the structures passing through the cavernous sinus. But these two structures I didn't draw in the lateral wall of cavernous sinus. I have drawn only these two branches. Now we will discuss about ophthalmic division of trigeminal nerve. This ophthalmic division of trigeminal nerve, at the anterior part of the cavernous sinus, it is divided into three branches. What are those? It is dividing into three branches: nasociliary, another is frontal, and one more is lacrimal. So here three branches. So these three branches are passing through the superior orbital fissure. But which part? Last session we discussed. See, this is superior orbital fissure. The superior orbital fissure divided into upper part, middle part and lower part, or lateral part, middle part and medial part by one common tendinous ring of Ginn. Is it? From that common tendinous ring of Ginn, recti muscles are taking origin. Is it? So through that superior orbital fissure, these nerves are passing. Actually, this is anatomical diagram. That's what you may be confused. I will draw schematic view. You can understand clearly. This is posterior part of orbit. That means this is at the apex. This is at the base. This is roof. This is floor. This is medial wall, and this is lateral wall. This foramen I am drawing here. What is this? Optic canal, right? And what is this fissure which is present in between the roof and lateral wall? What is that? Here, superior orbital fissure, right? So this superior orbital fissure encircled by common tendinous ring of Ginn, right? Within this common tendinous ring of Ginn, optic nerve is there, and also middle part of superior orbital fissure is there. Clear? So this is lateral part, this is middle part, and this is medial part. Is it? So in the lateralmost part, which nerve is passing? It is branched from the ophthalmic division of trigeminal nerve. What is that? Lacrimal nerve. So this is lacrimal nerve. Next, frontal nerve. Then fourth cranial nerve, that is trochlear nerve. Of course, recurrent meningeal branch here, and superior ophthalmic vein is here. Then in the middle part, nasociliary nerve. Nasociliary nerve. It is branched from the ophthalmic division of trigeminal nerve. Above and below the nasociliary nerve, we can found upper division and lower division of oculomotor nerve. right? Then one more nerve is passing through the central part. What is that? Sixth cranial nerve, abducens nerve. Then in the medial part, inferior ophthalmic vein. Is it? So these are the structures passing through the superior orbital fissure. Is it? So that structure we are seeing from behind. Is it? So these three branches are passing through this fissure. Clear? First, if you take lacrimal branch, that means this branch. This is lacrimal branch. This lacrimal branch is passing through the superior orbital fissure. It is passing through the superior orbital fissure and it enters into where? Orbit. Is it? So if you want to see the orbit, you have to break this bone. What is this bone here? Orbital plate of frontal bone. So you have to break this orbital plate of frontal bone and you have to see the interior of orbit. Is it? So in the dissection also you will do like that only. So I am breaking this part. I am breaking the orbital plate of frontal bone. Right? So now what you can see immediately after breaking the orbital plate of frontal bone, you can see the periorbitia or periosteum of orbit. Right? So you have to remove that periosteum of orbit also. Then you can see contents which are present in the orbit. What is the main structure which is present here? Here you can see eyeball. Then at the posterior pole of eyeball there will be optic nerve. So this is optic nerve. So this is optic nerve. At the lateral part you can see one gland. What is that gland? Here you can see one gland. What is this gland? Lacrimal gland. Is it? So this is lacrimal gland. This lacrimal nerve passing through the lateral part of superior orbital fissure and enters into orbit. So now it is entering into the orbit. After entering into the orbit, it runs superior to the lateral rectus muscle. That means above the lateral rectus muscle it runs and reaches to the gland. Which gland is this? What is this gland? Lacrimal gland, and passes deep to the lacrimal gland and reaches to the upper eyelid and it will supplies upper eyelid and it will terminate. So this is lacrimal nerve. It emerges in the upper eyelid, it will supplies there by lateral palpebral branches and it will terminate. Right? So it will give branches to the lacrimal gland and it will supply to the upper eyelid. Right? Then it will give one communicating branch. One communicating branch, that communicating branch to the zygomaticotemporal nerve. Zygomaticotemporal nerve is branched from the maxillary division of trigeminal nerve. Right? Actually, the bone fibers of lacrimal nerve are sensory fibers. But the communicating branch from the zygomaticotemporal nerve carries the secretomotor fibers to the lacrimal gland. Right? So it will give secretomotor fibers to the lacrimal gland. Right? So this is communicating branch. At this session you remember that it is having one communicating branch. In the maxillary nerve I will tell you how it will be communicating and how secretomotor fibers will be reaching to the lacrimal gland. Right? Otherwise now only I will tell so that you will get one idea. I am taking the section at this level, that means I am taking the sagittal section at this level, so that here this is anterior cranial fossa, this is middle cranial fossa and this is posterior cranial fossa. Below the anterior cranial fossa what is there? Orbit is there. Right? So this bone is frontal bone. Right? So this is frontal bone. Frontal bone having the frontal air sinuses, is it? So this is frontal bone and here maxilla. This is maxilla. This is the floor. This is roof of orbit. This is apex of petrous part of temporal bone. Over the apex of petrous part of temporal bone you can see this ganglion. What is this ganglion? What is this? Trigeminal ganglion. Is it? So here trigeminal ganglion. And what is this sinus? Cavernous sinus. So here cavernous sinus is there. Right? And what is this part? Pons. So it is connected to the pons, so that we have to draw pons here. So this is pons, this is medulla oblongata, and this is midbrain. Here cerebellum. Is it? So pons giving attachment to the fifth cranial nerve. So this is trigeminal nerve. Trigeminal nerve shows one ganglion here. Is it? That ganglion is trigeminal ganglion. This trigeminal ganglion gives three branches here. This is ophthalmic division of trigeminal nerve, and this is maxillary division of trigeminal nerve, and one more division that will not pass through the cavernous sinus, that will be passing through the foramen ovale and enters into infratemporal fossa. So that foramen will be here. Through that foramen it is entering into infratemporal fossa. Now we are least concerning about this nerve. So our motto is to explain the communicating branch from the zygomaticotemporal nerve to the lacrimal nerve. Is it? So ophthalmic division of trigeminal nerve passing through the cavernous sinus. At the anterior part of cavernous sinus, it is divided into three branches. What are those? One is nasociliary, frontal, and lacrimal. Is it? These three nerves enters into orbit through which fissure? Superior orbital fissure. So imagine this is superior orbital fissure. Now this is lacrimal nerve. This lacrimal nerve, after passing through the superior orbital fissure, it enters into where? It enters into orbit, passing superficial to the lateral rectus muscle, and somewhere here you can found gland. What is this gland? Lacrimal gland. Right? I didn't draw eyeball. Eyeball will be present here. This is optic nerve, and here eyeball. This is lacrimal nerve. Right? Now we have to see communicating branch from the zygomaticotemporal nerve. Is it? So now we will trace the maxillary nerve. See, this is maxillary nerve. This maxillary nerve pass through the cavernous sinus, and after passing through the cavernous sinus, it enters into one foramen and reaches to the pterygopalatine fossa. See, here there will be one fossa. This fossa, what we are calling pterygopalatine fossa. Is it? Here you can find pterygoid plate. This is pterygoid hamulus. Actually this is alveolar process, superior alveolar process. Is it? And here inferior alveolar process also present. This is how structure will be. Right? Now maxillary nerve pass through the foramen rotundum. Here one foramen will be there. That foramen what we are calling foramen rotundum. Through this foramen it enters into pterygopalatine fossa. This is maxillary nerve. This maxillary nerve continues as infraorbital nerve. It continues as infraorbital nerve. It is coming out from here and it passes through infraorbital groove. So first it passes through the infraorbital groove, right? Then it passes through the infraorbital canal. Then it comes out or it emerges out through the infraorbital foramen. So it comes out through the infraorbital foramen. Here foramen will be present. This foramen is infraorbital foramen, right? So it comes out and gives labial branch, nasal branch and palpebral branch, right? So this is course, but how this nerve will be communicating with the lacrimal nerve? That is our question, is it? So in the pterygopalatine fossa, it give one branch. That branch is zygomatic branch. Zygomatic nerve runs along the lateral wall of orbit outside the periosteum and it divides into zygomaticotemporal nerve and zygomaticofacial nerve. This zygomaticotemporal nerve communicating with the lacrimal nerve like this. This is communicating branch. Is it? The own fibers of lacrimal nerve are sensory fibers, but the communicating branch from the zygomaticotemporal nerve carries the secretomotor fibers to the lacrimal gland. Remaining course of the maxillary nerve we will see in the maxillary nerve. Now we will complete the ophthalmic division of trigeminal nerve. To explain about this communicating branch, I took this much time, but it works, right? So this is lacrimal nerve. Lacrimal nerve will supply to the upper eyelid, conjunctiva and lacrimal gland, right? So that is innervation. Now we will see next branch is frontal nerve. Frontal nerve also pass through the lateral part of superior orbital fissure. So it passes like this and enters into orbit and runs superficial to the levator palpebrae superioris muscle. That means it runs over the levator palpebrae superioris muscle. I didn't draw all those structures to avoid confusion. So this is frontal nerve. At the middle of the orbit, frontal nerve divides into two branches. What are those branches? Supraorbital and another one is supratrochlear. So this is supraorbital nerve and this is supratrochlear. First if we take supratrochlear. Trochlear means what? Trochlea of superior oblique muscle. It passes superficial to the trochlea of the superior oblique muscle and it emerges out from the orbit and appears in the face 1 finger breadth lateral to the midline. That means if it is median plane, 1 finger breadth lateral to the median plane, it will be appeared and it will supply to the upper eyelid, conjunctiva and small part of forehead above the root of the nose. Very simple. Supratrochlear nerve. Supra means above. Above the trochlea it is passing and emerges out from the orbit and appears in the face. There it will supply to the conjunctiva, upper eyelid and small part of forehead above the root of the nose. So that is about supratrochlear nerve. Is it? That means supratrochlear nerve coming out like this, right? So this is supratrochlear nerve. Then supraorbital nerve. Supraorbital nerve emerges out through the supraorbital foramen or supraorbital notch. 2 finger breadth from the medial plane. This is 1 finger breadth and this is 2 finger breadths lateral to the median plane. And it will supply to the central part of eyelid, that means central part of upper eyelid, and it will supply to the frontal air sinuses. Here frontal air sinuses will be there, right? So it will supply to the frontal air sinuses and it supplies to the forehead and scalp up to the vertex. It may go up to the lambda also. Actually forehead is common for both face and scalp. So that is about supraorbital nerve. We completed lacrimal nerve and frontal nerve. And what is remaining? Nasociliary, right? So this is nasociliary nerve. This nasociliary nerve passing through the central part of superior orbital fissure. So it passing through the central part of superior orbital fissure and enters into orbit. This nasociliary nerve, after entering into the orbit, it crosses the optic nerve from lateral to medial side. It crossing the optic nerve from lateral to medial side along with artery. Which artery? Ophthalmic artery. Along with ophthalmic artery, it is crossing. Of course, superior ophthalmic vein also will cross. So it is crossing like that. Anterior to it, artery is crossing. Which artery is this? Ophthalmic artery. Still more anteriorly, there will be superior ophthalmic vein. Here, superior ophthalmic vein. I am drawing very small because we don't want to disturb remaining structures, right? So this is nasociliary nerve. This nasociliary nerve runs along with ophthalmic artery along the medial wall of orbit in between the superior oblique muscle and medial rectus muscle. Then when it reaches to anterior ethmoidal canal, see this is anterior ethmoidal canal. when it reaches to anterior ethmoidal canal, it will be terminated after dividing into two branches. What are those branches? Anterior ethmoidal nerve and infratrochlear nerve. So this branch is anterior ethmoidal nerve. This anterior ethmoidal nerve passing through the anterior ethmoidal foramen. So this is the course. Now we will see what are the branches from the nasociliary nerve. See, this is optic nerve and somewhere here lateral rectus will be present. In between the optic nerve and lateral rectus, you can see one ganglion. What is that ganglion? Ciliary ganglion, right? So this is ciliary ganglion. To the ciliary ganglion, it will give one communicating branch, that is actually sensory branch, that is branch to the ciliary ganglion, right? Of course, we know from the ciliary ganglion, short ciliary nerves are arising. Those short ciliary nerves are piercing the sclera, that we have discussed already in the last session. So these are short ciliary nerves, right, from the ciliary ganglion. Then medial to the optic nerve, nasociliary nerve will give long ciliary nerves. Long ciliary nerves, 2 to 3 long ciliary nerves. These long ciliary nerves carries the sensation, or they will supply sensory nerves to the eyeball, right? So these are long ciliary nerves. They may contain few sympathetic fibers also. That is about long ciliary nerves. Then it will give one more branch here, that is passing through the posterior ethmoidal canal. What is this? This is posterior ethmoidal nerve, right? This posterior ethmoidal nerve, after passing through the posterior ethmoidal foramen, it supplies to the ethmoidal air sinuses and sphenoidal air sinuses. That's it. You remember up to that. Posterior ethmoidal nerve passing through the posterior ethmoidal foramen supplies to the ethmoidal air sinuses and sphenoidal air sinuses. Clear? That's it. Then you will see terminal branches. What are the terminal branches? Infratrochlear nerve and posterior ethmoidal nerve. Posterior ethmoidal nerve and infratrochlear nerve. First, if you take infratrochlear nerve, see, this is infratrochlear nerve. This infratrochlear nerve passing beneath the trochlea of superior oblique muscle and emerges above the medial angle of the eyelids, and it will supply to the eyelids, conjunctiva, lacrimal sac and lacrimal caruncles. Lacrimal sac, lacrimal caruncles, conjunctiva, medial part of eyelids. It will also supply to the upper part of the nose also. It will supply upper part of the nose. If you draw nose here, this is nose, right? So it will supply to the upper part of nose also, right? Then last branch, one more terminal branch is anterior ethmoidal nerve. This is anterior ethmoidal nerve. This anterior ethmoidal nerve passes through the anterior ethmoidal foramen and it appears in the, what is this? Anterior cranial fossa, and where it will supply to the meninges of anterior cranial fossa. Then it runs over the cribriform plate of ethmoid. Then it enters into the nose through this slit. I have drawn the slit on either side of the anterior part of crista galli. What is the slit? Nasal slit, right? Through this slit, it enters into nose. Then it passes deep to the nasal bone. See, this is nasal bone. It passes deep to the nasal bone. In the nose, it gives internal nasal branches. It will give internal nasal branches. Those are medial and lateral internal nasal branches. These medial and lateral internal nasal branches will supply to the mucosa of nose. Then it emerges below the lower border of nasal bone. That means in between the nasal cartilage and the inferior border of nasal bone, and it continues as external nasal branch or external nasal nerve. This external nasal nerve supplies lower part of the nose, right? So that is about anterior ethmoidal nerve. Recollect once again. Anterior ethmoidal nerve passing through the anterior ethmoidal foramen appears in the anterior cranial fossa, then runs over the cribriform plate of ethmoid and reaches to the slit which is present at the side of the crista galli. Through that slit it enters into nasal cavity and it is running deep to the nasal bone, where it will give two internal nasal branches. These internal nasal branches will supply to the nasal mucosa. When it reaches to the lower border of nasal bone, it emerges out as external nasal nerve to supply lower part of the nose. That's it, right? So this is the ophthalmic division of trigeminal nerve. I hope you understood. Now we will see some other nerves also present in the orbit, but I will not go in detail. I will tell you very briefly. See, third cranial nerve. This is third cranial nerve. This third cranial nerve is coming from the midbrain. Is it? It passes through the cavernous sinus, right? Where in the upper part of cavernous sinus. When it reaches to the anterior part of cavernous sinus, it divides into upper division and lower division. So this is upper division and this is lower division. This upper division and lower division passing through the central part of superior orbital fissure. In between these two divisions, Nasociliary nerve will be present. So if you want to draw exactly, it is like this. Then this upper division supplies to the superior rectus levator palpebrae superioris. That's it. Lower division will supply to the inferior oblique, inferior rectus and medial rectus. That's it. Because lateral rectus is supplied by 6th cranial nerve, superior oblique is supplied by 4th cranial nerve. That means trochlear nerve. That is about oculomotor nerve or third cranial nerve. Actually, lower division is carrying the parasympathetic nerves that we discussed in the ciliary ganglion. Then 4th cranial nerve. 4th cranial nerve also from the midbrain. It runs like this and it passes through the cavernous sinus and it enters into the orbit after passing through the superior orbital fissure, that too lateral part of superior orbital fissure. Then it runs medially and reaches to the lower part of superior oblique muscle, where it will supplies. That means it will supply to the superior oblique muscle. That's it. Then 6th cranial nerve. This is 6th cranial nerve. This 6th cranial nerve is passing through the cavernous sinus just below the internal carotid artery. Then it passes through the central part of superior orbital fissure and reaches to the orbit, and it crosses laterally in the orbit. It will supply to the lateral rectus muscle. That is about 6th cranial nerve. These are the nerves which are present in